Hey everyone, welcome back to my channel. My name is Ida. I'm here with my sister
Diana,
and I am a researcher in Sweden. I make videos about lifestyle, work and studies abroad, and then I also live with my family here. So yeah, we are here to have a nice conversation. If you want to know how to be a nurse in Sweden or a nurse in US, then stay tuned. So because we have a lot of juicy information for you. Yeah. How are you?
yeah, I'm doing great.
Yeah. So how has Sweden been so far for you?
Beautiful land, and it's a different culture. We could learn many things new. Recent advancements, modernization, and technology. So many new things which we could get an updated knowledge. They're a developed country, and of course they are very high tech in everything.
It's very nice to have you here to talk about your experience. And she's a nurse here, and she's been a nurse. You've been practicing nursing in India, and you are now a certified nurse in Sweden.
Yes.
And a certified nurse in US.
Yes.
So tell us how you became a nurse in Sweden.
It's a people work actually. So we have to speak with people, and the basic requirement is we should be able to speak Swedish.
Yes.
So it's not only speak Swedish, but we should have education according to their level to prove that yes, I can read, I can write, I can understand, I can be fluent with Swedish, so that I can manage my work in a hospital as a nurse.
Okay. Yeah. Right. So how long did it take you to meet the language requirements? What was
actually, it took me around 2.5 years, I think so, to complete, because I started in 2016 as early as possible, because my husband's company provided the orientation program where we were already in a fixed language learning program. So they supported in a very intensive course. So I started there, and then I went to SFE. It's a Swedish
for immigrants.
Yeah, exactly. So Swedish for immigrants, and there I started my C.D. E. So I just took 3 months or 3 to 4 months for every level. So I completed my SAS 3, that is the Swedish Svenska som andra språk 3, 2018. So it was from 2016 February I started, and I completed in 2018 March.
Wow.
So it was almost 2 years.
Yes.
And then I had to apply for the university, because I need to get a license here. So the basic requirement is complete about the Swedish, and to get the license I need to write the exam, which I cannot prepare myself.
What's the name of that course?
It's completerande course.
Okay.
Completerande course. Supplementary, exactly.
For your nursing degree.
Exactly. Those who already have a nursing pursued a nursing degree.
So how long did it take you for that?
It was a 1 year course.
1 year, okay.
During my time, but now they have extended to 1.5 years, or it can be increased also, because what challenges we had was like even myself, I had a challenge when I joined the course. I was of course good in Swedish, but not up to that level.
So how was the feeling when you wrote the exams in Swedish and passed?
Yeah, it was. I could say I was flying in the air. I know that I will pass the exam, because I was just working very hard, and I could see the performance of all the tests and everything. But the thing is, I had a aim that I should have this much score. Of course, nobody's bothered about the score, but I myself set a goal, like I should get above 80%. So that was a stress I had, but I achieved it.
You gave your own mark.
Exactly.
Wow. So how much did you get?
I got about 84%.
84%.
Yeah.
And what's the pass mark?
It was like, I think 50% maybe.
You're super smart. Okay. Now you got your certificates.
Yeah.
Like after the exams, and then you passed. What do you need to do to get? Can you just get a job right away, or you have to do another authorities like check-in before you get your?
Yeah, actually during the course, I will just tell it in a nutshell. It is a combination of theory and there is a KOTC. That means it's a practical test. So we have to show on the demo.
I have to demo
with a toy.
With a dummy.
Dummy, exactly,
yes,
dummy.
okay.
So we have to do the demo with the dummy, as we have to just pretend as if
Pretend
they are the patients. So the way we speak, everything should be, and my examiner will be the patient's voice actually.
Okay.
So that way we have to do it, and that's the first. After the 6 months, if we are clear of that, then we will be going to the next step.
Okay.
So that was a very tough part, and the other one was the theoretical examination. It's called NCO-SC, NCO Nakunala Klinisk Sluth Examination.
Okay.
So that was very tough. We were the first batch to take the exam.
Wow.
So that is a stample that she is a competent nurse.
Yeah.
That NCO is a stample.
Yeah. Oh, that's nice. So then after that, what happened?
After I completed my exam, I came to know that I passed, and I just went for some interview to the hospital, and it took some time, around 1 month something, to get my license. So during that time, I just joined as assistant nurse, and of course they trained me
as an assistant
nurse
okay.
till I get my license.
Okay. So as soon as you finished the exam,
exactly,
there was job for you.
Exactly.
Wow. And then you waited for 1 month, and then you got your certificates.
Yeah.
And then what happened?
After that, I was working as a licensed nurse.
Wow.
So
the hospital employed you before your certificate.
Exactly.
So after the certificate, they changed it to like a full
Koteska. Exactly.
The Swedish version of
nurse. She's an independent licensed nurse. Yeah.
Wow.
She can work independently.
Wow.
That is a big difference from my country to Sweden, because there we are not independent.
Yeah.
We are controlled or under the doctors, and our knowledge, competence is not being valued. So we cannot think by ourselves, do things ourselves. So but here it is more of independence. So that's why it's very essential. It's very, very important to have the knowledge and confidence, and that's why we need a stample of NCO.
Yeah. Wow. So can you give me a picture of a nurse, being a nurse in Sweden and a nurse in India? What do you think is the difference?
I could say in the way of
workload,
knowledge.
You can start with
the workload. I could say there a nurse should be able to take care of 20 patients, but the ratio I could say, but in a normal ward. But here, even in the medical surgical ward, where I'm working in a surgical ward, we do have 1:7. One nurse for 7 patients or one nurse for 5 patients.
Wow.
So it's a big difference actually.
Okay.
So, and it's not the same care we give in India. It's a very superficial care, and because it's very difficult to be very give a complete in-depth care because of the ratio workload. But here it's a very it's a different way. It's a complete care which we have to give, and the quality of care is different. Is there?
Okay. What about the technologies involved?
The technologies, of course, they have modernized equipments. Like if you want to take the vital signs, we don't need to carry each and everything with us. We just have a trolley with all the things, and just we have to connect with the patient and just take it. And we do have different electronical things like infusion pumps and blood warmers, and ECG is like different ways. So it's very highly modernized and technological equipments which we really use, which will help us to give a better care.
And about the knowledge aspects?
Knowledge aspect is, of course, even though we study many things, we are not applying everything in our practice in India. But here it is, we are having the ability, and we are having the rounds will be in a different way, where we discuss with the doctors alone first, and sometimes give suggestions to the doctors, whether can we do this way or that way, why can't we do this, asking questions so they can explain to us. Sometimes they accept our suggestions, they respect us, and it is more of equality. So it is not like I'm superior and you're inferior. That feeling never comes here. But in India, it is a very big difference. Like we cannot even ask a question because they think that we are too smart.
Okay. So how long have you been working as a nurse in Sweden?
I think it's going to be 3.5
Wow.
years.
And in which department are you working?
I was working in a surgical department. And mostly focused on the abdominal surgeries.
Abdominal.
Gallbladder.
Gallbladder.
And pancreatitis and ileus related to intestines and appendicectomy. So mostly it's related to that area.
Okay.
Specialization.
Well, I'm not a nurse and I don't know how I'll feel if I'm seeing blood every day with people in pain. But how do you feel when you are, that's your work?
Yeah, exactly.
You can't escape.
The first thing what we have to think, what I need to do there. So I cannot think that, oh, this is the problem. What I need to do there to help that person. That's the first thing we as a nurse would think.
Okay.
Because that's our job. That's why the patients are here to seek our help.
I have another question. So if you feel normal about it, does it make you less sympathetic?
Some people can think in that way. It is not like sympathetic. For example, I could say like I do see patients having fever every day, and what the next I need to give to them is a paracetamol or give some sponge, something. I have to manage that fever or find the cause why they are having, do a blood test or something. What we need to do next. So I cannot just go and say, oh my God, you are having a fever. Oh, what you have? Oh, I don't worry about that. I cannot speak in that way.
You should just try and fix the problem.
Exactly, fix the problem. So
you're like an engineer fixing a car.
Exactly. It's like fixing the body.
Yeah, fixing the body. Yeah. That's interesting. You already talked about your relation with doctors, but the work environment, how is it like?
Especially in Sweden, it's very important to have a peaceful work environment. They're working really hard for that. They have a survey for that, how to just ask the employees, to how do they feel, is there any abuse going on, or how the things are going on between the colleagues, is there any conflicts. And we do have some webinars or lessons, like how do you say, like a conference or no, it's workshop? Like a workshop maybe, about conflict handling and all those things, so which will help us how to handle the things in a better way.
Any racism at work?
So of course we could feel that in some or the other way. Maybe it cannot be racism, something else, but we will feel like a racism. So it is, we cannot make it 100% sure that is a racism, but of course we may feel it's individual feeling, I could say.
But with the patients, do they prefer you over, or do they prefer Swedish nurses over you?
It depends. It depends.
Okay.
Yeah, it depends. It's not all the patients. Sometimes I've experienced older patients. They were really feeling very happy when we take care of them, and they say that Swedish people are very hard-hearted, and it's very difficult for them to show the sympathy and empathy, just do the duties for the name's sake. But there are patients like they really be very happy to speak with the Swedish nurses, and not too much with us, like.
So thank you. Do you want to tell them anything?
Nothing.
Just come on your own and come and try.
And
subscribe and hit the like button, and also share for everybody to know, because we had a very interesting conversation. I don't know, I enjoyed the conversation. Maybe you also did. So in the next video, we'll talk about how to become a nurse in the US if you're interested. The process that you need to do, the examinations that you have to write, and then you can take your decision from them. Thank you guys for watching this video. If you like it, give it a thumbs up. If you want me to do more videos, subscribe. If you want to be notified for next videos, hit the notification bell. And adios. Hey do, BCS.